Hello, everyone, and welcome to another episode of the Pelvic Bowl. I'm Dr. Krystal Lynn Couture with the Pelvic Acu, where we teach pelvic health continuing education to acupuncturists. Today, I'm joined by Lindsey Lawson. Lindsey is a board-certified reproductive specialist with ABORM, as well as a certified endometriosis specialist through iCareBetter. She practices acupuncture for women's health issues, including fertility, pregnancy, and postpartum care. Lindsey has a special interest in endometriosis and fibroid treatment, including pre- and post-surgical care through full spectrum fibroid and endometriosis. Lindsey is the clinical director for both Glow Natural Health and Seattle Fertility Acupuncture. Welcome, Lindsey.
Thank you very much. Pleasure to be here.
It's a pleasure to have you. I'm really excited that we're finally getting this opportunity to reconnect because you took our practical in Seattle last September, right?
Fall. Let's just say fall.
Fall, yeah. And so since then, congratulations, you've completed your advanced certificate, which is really, really exciting. I would love to first kind of dive in to your journey, sort of leading up to the moment you decided to jump into pelvic care and pelvic health.
Yeah. So I went to acupuncture school back in 1997. And when I got out, I immediately got a specialty in women's health and worked in our same facility, Glow Natural Health, which is an integrative facility with naturopaths, massage, chiropractors, psychotherapists. So a bit of a general practice as well as women's health. And then over the years, began to specialize further into fertility, pregnancy, postpartum care. I really wanted to make sure I had a child first before I took that on as a specialty. So that took a little while in life. And then, over the years, always just looking for more tools in my toolbox. I really like to solve complex problems. And with fertility, there were certain women coming in that clearly had more going on than others, shall we say. And I felt they needed a little bit more. And also that weren't really being served very well by fertility clinics. And just wanted ways to help them. And when I started working at Full Spectrum, which specializes, as you just said, in endometriosis, fibroid care, that felt like the right time to add more to the picture, since I would really be seeing a lot of these women with more of a pelvic pain pattern. And you had been on my radar for a while, but it just hadn't been the right time. And that was the time.
Cool. Perfect. So you had this passion for fertility and pregnancy and postpartum that was sort of like running through your veins, it sounds like, for a really long time. And then where did the piece for endometriosis and fibroids come in for you?
Yeah, like I said, especially endometriosis is sort of bypassed by fertility treatments a lot, or attempted to bypass, which is good as long as people get pregnant and that's their goal. But then they're left with these long-standing symptoms. And there's a lot of medical misogyny that happens for these women. There's a lot of trauma, and there's many, many layers, as you know. I'm not telling you anything that you don't know already. And I felt like, as an acupuncturist and an herbalist, I'm poised in the right place to be able to really help these people on a deeper level. And this kind of work seemed like it would go hand in hand with that.
Yeah, absolutely. Absolutely. And so what do you think, now that you've taken the practical and you've gone through the advanced certificate in pelvic health, what do you think are the deep connections between the pelvic floor and that fertility and that endometriosis journey? That interplay is so important. But
Yeah.
give me your practical, your clinical, your energetic
hmm
experience. Yeah.
Yeah. I think right now, what has been on my mind a lot lately is the connection between the two diaphragms and the blockage that happens there. And, if you're blocked in this middle section and it's pulling up the lower one and what that means, the heart and the uterus connection there. These are all on energetic levels. But on a physical level, sometimes you really have to just go to the source of the pain, and that can be an intimate location for some women, but that is healing also if it's in a safe place and in a container of care, and maybe allows them to access things, all kinds of things, physical and emotional and trauma that maybe they weren't able to do before.
Yeah, absolutely. So it sounds like that the diaphragms you're talking about, I'm assuming, are the respiratory diaphragm and the pelvic diaphragm, right?
Yeah, exactly.
Yeah. So that connection is really huge. And I find that just sharing awareness with clients, just getting them on board with a simple tool like the pelvic breath builds so much of a foundation for the work that we're doing for fertility, the work that we're doing for endo, the work that we're doing for the pelvic floor, right?
Yeah. That was one of my take homes from your practical class, actually, is that, you were talking about that from the moment the class started. And I was like, well, this is a person who does this all the time. So they know what they're doing, and I should pay attention to that. And it wasn't a real revelation. Obviously, I've been practicing a long time, and I know that. But to be able to kind of have that front and center of my brain when I'm starting the conversation, I can be a little bit direct sometimes. So, sometimes you have to be a little less direct in order for things to be effective. So that's kind of a good way to start. And also, I do a lot of abdominal palpation, and all you have to do is a lot of palpation in general. All you have to do is feel that area on most of these women. And if it's tender and they can't breathe through their diaphragm area, then obviously we have to start there.
Hmm. I love where this conversation is going, Lindsey. So we're talking about you and I both. We love treating complex cases that probably wrap fertility, endometriosis, emotional trauma, and the pelvic floor all together. And then when we start treating it, we go back to the simplest tool or
For sure.
tactic, which is the breath, right?
Yep.
And so I love how through complexity, we see the simplicity of providing a foundation for treatment, for providing a foundation for building rapport, as you alluded to, for getting our clients to feel like they have a safe container to talk about things that they might not have had the opportunity to talk about candidly, might be
Yeah.
scared to talk about, might not have enough time to talk about. I really love that. And that's sort of like an aha moment that I think if people are listening, that when we do have these complex cases, can we be the master technicians and find the perfect points? Sure. And can we also take it back to baseline so that we really get a clear direction and really get this client on board with their body, on board with their care plan, and on board with what's possible for them.
For sure. And then it helps your points work better too.
Right?
You're giving their body like the tool it needs for that to make change.
Yeah, I love that. And I think so often, we're busy as practitioners and our inboxes are full and we're some of us are trying to do too much. We don't have people helping us, right? And when that happens, then we can sort of skip that like how do we make our treatments more effective? And it's as simple as we give them a recording of the pelvic breath or a handout or something. And like electronic medical records are great now. You can literally attach a handout, a PDF, a video, a whatever right to it. And it just sends to the client after they
For
book
sure.
their session, right?
Yep.
So using these tools, we're talking a little bit about like the business of acupuncture here, but utilizing tools like that, even though it takes some time on the front end, it's so helpful for us as we're taking these complex cases. And I think, like you said, it helps to build that investment from the client into their care.
Yeah. I mean, I have all kinds of handouts. I give people handouts every single day, you know. I really like almost every patient because there's just information that they need to have. Like, this is going to help this whole situation work better if you know whatever it is, diet, breath, lifestyle. It's such a complicated situation that you have to integrate those pieces or you're missing a big chunk, I feel.
Yeah, yeah, for sure. That self-care piece takes it from, someone asking us to heal them or fix them to them being invested and their body on board with
Yeah.
healing itself, which is really the magic of what we're doing. Our needle is a tool to help the body heal itself.
Hmm.
Um,
Exactly.
yeah, so we talked about the pelvic breath. I love the pelvic breath. I'm glad you love the pelvic breath tool. Are there
Hmm.
any other like tools that you found that were super helpful that you learned in the practical or through your time in the courses? I know that's sort of an open-ended and difficult question because it's, I don't know, what, 48 hours of coursework, but anything that sticks out.
Yeah, I mean, really why I was there initially was to be learning how to treat things like pudendal nerve pain that I wasn't being super successful with. And there was a lot of tools that I got around that for
Mhm.
sure. I'm
Mhm.
continuing to develop how that's going to impact my own practice. We do a lot of injection therapy too. So, um, trying to develop a program around injecting for pudendal nerve pain and working concurrently with doctors who are doing blocks for that as well.
Mhm.
And like, what does that look like? How long do people have relief and when does it start coming back? And what kind of acupuncture plan works best to support that?
Yeah.
So that was, pretty huge. That was definitely a jump in my understanding. I
Yes.
would say also the more dry needling type of technique was not unknown to me, but not a thing that I was doing that much regularly. And I definitely am using that a lot more than I did before, specifically for these women.
Mhm.
And it's a strong tool. It's a very strong tool. And sometimes they need strong medicine.
Yeah,
So,
for sure, for sure. And do you enjoy, this is something I love so much. You may or may not, but let's talk about it. Do you enjoy the like concomitant work of being able to do some of like the orthopedic or Ashi point needling or dry needling with TCM or tongue
yeah.
or whatever it is that you practice? Yeah.
Yeah, 100%. Like I said, I'm a collector of tools in my toolbox. So I like all the things. Um, I've been known to do an aggressive energy treatment. I've been known to do some other modalities that maybe other people don't use as much. Um, at the same time, in a separate session, all different kinds of ways. So I'm an active person myself. I had a sports injury in high school where I tore my ACL and then I tore it again and then I tore all the cartilage. So I'm pretty aware of orthopedic style and physical therapy. I've done tons of physical therapy myself.
Yeah.
So I I think that they're invaluable tools and they need to be used together a lot of times.
Mm, mm, yeah, I love that. So there's this interplay, right? Like I love to play with. I love to interact with that interplay of TCM and ortho and spirit and
Yeah.
however we can meet the person where they are. Um, I also love the interplay of how like concomitant structures can impact, the pelvic floor, for instance. And that's something we do a lot in our classes, right? Is like working with the abdomen in order to help release the back.
Yes.
And working with the structures of the posterior rotators to help with the pelvic floor and that kind of thing. So have you found that sort of concomitant needling work to be something that you enjoy, that you see results with?
Yeah, for sure. I mean, I was already doing that kind of work.
Yeah.
Like I said, I work with a chiropractor. So there are some times where I'm doing pretty physically oriented stuff,
Hmm.
sports relief, car accidents, all kinds of things like that. But again, the needling style slightly different. So
Hmm.
I've been using that more in that way, and also maybe using more needles and not being afraid to do that. Not that I was, I've used
Sure.
plenty of needles, but like strong stimulation and lots of points, maybe on both sides of the body on the same treatment, even, depending on the person. And yeah, I know I've loved that. I loved like I said, I do a lot of abdominal palpation too. So it's not like I didn't already feel these adhesions, but then doing a trigger point release on that was not something that I was consistently doing. Let's put it that way. So, and I really liked your psoas treatment. I treat the psoas a lot and I always have, but learning to treat it in that certain way was big, and it's intense, but it's effective. So I like that.
I love that, Lindsey. I love how your personality is really, coming out in this and how it's clear how you're here, right, for your clients. You want them to get better and
For sure.
you're willing to share whatever knowledge it is that you have and within your practice that can help and support them. And I think that's great that you have this level of confidence, comfort, and perseverance to want to help clients that might have fallen through the cracks, in other
Yeah.
systems.
Yep, for
So
sure.
that's really, really notable and very, very obvious as we're spending this time together, which I love. Um, do you have any success stories? Like, I would love a pelvic floor success story. I would really love a pelvic floor endo and fertility success story if you've got one.
Oh yeah. I have lots of those. Um, let's see. I had a patient, she started coming in for natural fertility and she saw me for natural fertility for probably about 2 years, year and a half. And we were making a lot of progress.
Hmm.
And she was very unaware of her body and her cycles and everything. And there was a lot going on there, but it was a slow process of being able to kind of unfold and talk about that. And, eventually, I mean, she had PCOS. She also had endo. So eventually we were able to send her to the right specialist to start to get diagnoses for these things.
Hmm.
And she also had a real hard time with her consistent, appropriate self care, diet,
Mm.
exercise, sleeping. It was just not her jam. I think if we could have had all those things, maybe we wouldn't have had to go to these additional specialists, but that wasn't happening. So then she went and had the excision surgery. So I supported her through that process.
Mhm.
And I saw her just about a week after her excision surgery. And yeah, and then supported her up until her first period, which was still pretty intense after that.
Mhm.
Less pain, but still painful. And, there's still a lot of fear that is it going to be the same? Is it going to come back? What is it going to look like going forward? And they're not really going to know for about a year after their surgery what their
Absolutely.
results are going to be. So then we began doing more of the pelvic floor work just to really get things on track.
Mhm.
And she started taking some metformin to help her ovulate appropriately. And she became pregnant naturally, which was amazing.
Wow.
It was a journey to get there, but she was already working with fertility clinics, but she didn't need to go down that route. I mean, she went and had the testing,
Sure.
made sure her tubes were open, did all that kind
Yep.
of stuff, but she
Yep.
didn't have to do IVF or IUIs or even a medicated cycle. So that was pretty amazing.
That is really amazing. I'm so glad that
Yeah.
she found you when she did.
Yeah.
Probably
It
saved
felt
her,
serendipitous.
yeah, it probably saved her a lot of money in the long run.
Yep.
So that's because she would be someone that a fertility clinic would, take on, right? To,
Right.
yeah, go forth with care, because of her history and that kind of thing. I'm curious, did she, as time went on, did she get into the self-care bit on her own? Like as she started to feel better, as her hormones were more balanced?
Yeah, she did. I mean, it was, I always say progress isn't a linear line,
Hmm.
so it was like this. And so at one point in there, she took a break for like 6 months
Hmm.
from acupuncture. And then she came back and had a renewed zest. And
Mm.
sometimes you have to do that. It's a long journey,
It is.
and it's hard to have those disappointments every month and also be having pain and not feeling good. I mean, these aren't the only things that didn't feel good. There was a
Right.
lot of things that were not going well health wise for her.
Yeah.
Um, but she also then could really see how the acupuncture had been impacting her because she had taken that long break. She's like, wow, I was really a lot better when I was coming regularly and I was doing all the things,
Yep.
you know?
Yep.
So,
Yeah. I love that. I really, really think that approach is like it is so helpful. And you're right. Sometimes a little space away does give us that perspective and that opportunity to rekindle the fire for, in her case, taking care of herself, prioritizing her, women's health conditions, situation, and getting pregnant.
yep, exactly.
Yeah. Yeah, right on. Thanks. What a cool story. Um,
Super cool.
yeah, super cool for sure. Um, so tell me more about kind of how easy or difficult it has been to bring in pelvic care treatments to your practice.
Yeah.
From one, the logistical perspective, and two, that emotional hurdle, right? That we all kind of work with as we try to integrate something new that we're not perhaps instantly as comfortable with as our norm.
Yeah, I think integrating more of the pelvic floor work into my practice was um, pretty easy in as far as acquiring the patients who wanted that work.
Mhm.
And I think the connection that we have with full spectrum OBGYN was really useful there. I knew those people were waiting. I mean, they were literally like knocking on the door. And having that work done myself in the practical was really valuable for me in being able to integrate it in the clinic because I know exactly what that person is feeling. And I shouldn't say exactly because I don't have pelvic pain. So I wasn't coming in with that perspective, but I know the vulnerability of it. And I also know the impact of it. And so I can speak to both of those things pretty clearly.
Mhm.
Um, and then it's just a matter of, getting your rhythm down in your routine and, you know, what room can I use for that? Do I have all the things that I need to make this person feel comfortable with this? What does it look like leading up to it as far as, our conversation? And, have they never had acupuncture before? Then obviously we're not going to do that on the first day, that kind of thing.
Right.
But starting, like you said, with the abdomen, with the back, with the adductors, the glutes, all those things. I mean, we're already doing it. So, it's, I think, pretty important to do that anyway in most cases.
Yeah.
So it works out just fine.
Yeah.
But yeah, it's been interesting. I mean, it's maybe a larger percentage of what I'm doing that I thought I would be doing.
Mhm.
So there's that, but I enjoy it. So it's okay.
I love
Sometimes I
that.
say to myself, I really never thought this is where my acupuncture career would end up, but it did. I also used to think that back when I was still just beginning to do more postpartum fertility work, I'd be gua shaing somebody's breasts, and I'm think, nope, not a thing I thought would be happening. But
Okay.
life is funny like that.
Hold the phones for just a sec. You didn't think
Yeah.
somehow that gua shaing someone's breasts would eventually end up to needling a pelvic floor. Come on, Lindsay.
Right. Yeah. I think I probably should have. Yeah. I'm not the brightest sometimes.
No, not at all. It's funny how that sort of happens and how we find our way into a specialty. I love that for the most part, it sounds like this integrated really seamlessly once you were able to really figure out those logistics of how do I want this to look in my clinic? What's my schedule like? And can I make sure that I have all the things so that, I'm not contributing to somebody feeling more uncomfortable in a vulnerable situation.
For sure.
I love that. So, and it seems like you have, right, a good base of experience. You're a seasoned practitioner, and you're seasoned at talking about things that are less comfortable. If you had advice to give to someone who is less seasoned about bringing pelvic care into practice, um,
Mm.
what advice would you give them? And part two of that is, how would you encourage them to develop a relationship with a gynecology practice?
Right. I think number one is really important to keep at the front of your mind is to have a trauma-informed perspective. Just know that like you don't know what you're going to trigger for this person, even in the conversation, and start with that and then take their cues. But also don't be afraid to challenge yourself a little bit too. There is often that feeling of like, you may have your own issues that come up, just like you do with it in any type of person that comes in with the practice. I mean, it's always your own personal work that goes on at the same time. As far as integrating with Western physicians, always reaching out if they're seeing another doctor, reaching out with a letter that says, this is what I'm doing for this person, and I just wanted you to know here's what their treatment plan is. I'm supporting what you're doing, and also identifying who are those specialists that you really should know. You maybe don't need to make friends with a GP who's not specializing in this, even though your patient with pelvic pain is going to them, but you'd be better off to find someone who's really doing what you want to be doing and then telling them what you're doing for their patients and how you're supporting them.
Yeah, I love that. And building that personal relationship can just be so instrumental in having referrals and also
Mm-hmm.
being able to refer to, I think some acupuncturists sort of get into this mindset like, oh, if I'm asking this gynecologist that specializes in endometriosis for referrals, it's a one-sided relationship. At the same time, how many times a day do we see people that are like, my gyne isn't hearing what I'm saying, or I don't feel comfortable, or they moved away, right? So I think this mindset of this is a reciprocal relationship,
We
and
are actually more valuable to them than they are to us
absolutely.
because their surgery is going to cost $10,000 out of pocket. And if we're encouraging a person that this is going to help them and they trust us, we're a great referral source. I
Absolutely.
mean, what is a couple $100 to come see me, like it's not even in the same category. Or IVF, same thing,
Yes.
20,
Yes.
$30,000, not even the same category,
Right.
so they want to know us for sure. We just have to understand that piece.
Yeah, love it. I really love that mindset. I love how we're sort of like playing with the business side of this as well as really getting deep into what is honoring, pelvic health and um patient-centered care.
Yeah.
So this I feel like this conversation is really rich. So thanks for
Yeah. I mean, I think a lot of us get into this and we don't want to be in business. Business is like almost taboo, but then welcome, you're in business.
here we
So
are.
you have to learn about it also. It's another thing that's part of the equation in being able to see patients. If you don't have a business, you're not going to see any patients.
Totally. Truth bomb right there.
Yeah,
Yeah.
right.
Yeah, exactly. I feel you. And you have associates at your business, at your practice, Lindsay?
Yep,
Yeah.
we do.
So I think this is like such a great thing too, is that when we have associate acupuncturists or we can work together and have that mentorship sort of built into a practice model, it's really great. And I think it's a step that's missing because for acupuncturists, there are less of us, right, than other professionals. And
Yep.
so starting a practice on our own or working for a bigger practice sort of like are the only options. And we're not so educated in that in school. But I love
Yeah.
this associate model for younger practitioners too, because it's like in order to be a successful acupuncturist, do you have to have your own practice? And I don't think the answer to
Right.
that is yes for everybody. I think
For
some
sure.
people love the idea of saying, you know what, the business aspect, I have no interest in it, but I would love to specialize in fertility. And oh, Lindsay's here and she does endometriosis and pelvic floor, but I love whatever it might be. I love PCOS, or
Yeah.
I love, X, Y, and Z. And like she could really be a mentor and we could work, side by side together and have a relationship. So that's sort of how I'm seeing associates as someone who's been in business for 19 years now. But give me your perspective too. Since we went there, let's go
Yeah.
all in.
Yeah. No, for sure. When I graduated, they told me I was gonna get a job in a hospital, make 85,000 right out of school. And I got out of school with, a 2-day workshop on writing a business plan as my only business training.
Yeah.
And there were no jobs.
Yeah.
I was like, where are the jobs? I was looking around, there are no jobs. And the reality was harsh. And then a few years into it, I saw really good practitioners, like people that I looked up to in school as being better than me, failing at having businesses and stopping doing acupuncture. And that was heartbreaking.
Hmm.
And I've never loved business, but I think I'm pretty good at business. I mean, not to toot my own horn, but like I can do the things that are necessary. And I looked around and I was like, okay, I'm going to do the things, and then I'm going to make jobs for other people so that those good practitioners can make it. And even if like it's an incubation place for them to figure out how to see 10 people in a day and not be exhausted, or how to do their charts in a day and get them done, whatever it is that they struggle with,
Hmm.
once they can get their footing, if they're going to go on and do their own thing, that's great. Like, I mean, I love work. I like working with other people. I like collaborating, and I like talking about patients. I like different perspectives. In our clinic, often we will share patients, and we sort of strive for that culture,
Hmm.
especially if they are requiring frequency, or
Yes.
if they're doing IVF where they're going to have certain days that they want to come in. We want them to feel comfortable with anybody here. And I learn a lot from other people. So hopefully that answers your question. Yeah, I
Absolutely.
love having associates for sure. We're hiring, so if anybody wants to come and work in Seattle and do pelvic floor work.
Lindsay's in Seattle. Well, that's a great moment to mention we are coming back to Seattle in the fall again. So we'll be
Yes.
back at the Seattle Institute of East Asian Medicine in September. I don't remember the dates, but we'll put it in the show notes. And
Yeah.
maybe we'll get to see Lindsay again. But we'll
Yeah. I have
definitely
an
be.
associate who's going to be taking it with you. So I'm really
Yay!
excited.
Oh, that's awesome. I love that.
Hmm.
So that's great. So what would you say? Let's sort of start our wrap here. What would you say if we've got other acupuncturists who are thinking about adding pelvic care to their practices, don't really know how, don't know how it fits? What would you say to them?
Yeah. I would say do it. I think once you take the practical and do the advanced course, you give a lot of tools. You will set them up with the tools that they need, and the rest will come naturally. Also, other providers are doing this kind of work. PTs are doing dry needling. So you can either think that they shouldn't do that, or you can just claim that as being acupuncture and like get the patients to come to you.
Yes.
And then you've got all of your tools that you can use with them as well.
Yeah, I love that. I love that. And I think there's one thing, and maybe you can comment on this too, is that when you add a specialty, I think some people are afraid to add a specialty because it can take away from the sacredness of the way that they're delivering the
Yes.
medicine, right?
Yeah.
And so, how would you weigh in on that?
Like I said, I think it's a tool. And, you still are talking to them about treating the whole person.
Yeah.
You're still talking to them about the energetics, whatever it is that is your thing. You're not doing your thing. You're
Yeah.
just adding another piece to that, and you can pick and choose how you want to use that, whatever feels best to you.
Yeah.
I mean, you don't have to necessarily be needling, anything that makes you feel uncomfortable either, just the stomach and the back points are going to be really useful. The leg points, all those are really, really valuable on their own. But learning how to use them in this way will be a little bit different than what you learned in the past. And that will inform your choices.
Yeah, for sure, for sure. So one does not lose their identity as an acupuncturist, as a
Definitely not.
practitioner of East Asian medicine by having a specialty. And I really enjoy how we can all have different backgrounds. We have 5 element practitioners, we have TCM practitioners, we have tongue practitioners, we have esoteric practitioners, we have people that like do very little needling and have other styles of practice, and they're still coming into our classes. And that sort of community, right, is really, really rich. And this is a tool, and our goal is never to change your identity, but rather to give you, like Lindsey said, that tool in your toolbox that is going to take what you're doing to the next level with your clients.
Everybody has a pelvis.
Everybody's got a pelvis, and everybody's got a pelvic floor too. Yes, that's
Yep.
perfect. Okay, so rapid fire. What would you say right now is your favorite, like your hot topic in the clinic?
Mm. Gosh, that's so hard. I think that, pudendal neuralgia, I have a couple patients right now that are male and female
Hmm.
patients
Hmm.
that we're working through it. And it's cool because there's a lot of progress that's happening. It's not immediate, but it does happen. Sometimes it's immediate. Sometimes you have that breakthrough day.
Yes.
But I really like that a lot. I mean, endo, I'm still really into that right now because, it's not new, but like I've got a lot more tools and depth in that than I've had for a long, long time. And it's very complicated. It's really similar to cancer in a way, except you're not going to die from it, but multiple organ systems being involved, and different presentations, different patterns that can come in. So that's definitely on my mind a lot.
Good. What's the best advice that you ever received, as a practitioner?
My gosh, that's a really hard question. I don't know if I feel like I've ever received any advice that has stuck with me other than just keep going. I think just don't get discouraged and just pick yourself back up, dust yourself off, and, continue to do what you know to do.
Yeah,
It will happen eventually. Perseverance is like half the battle, I feel.
absolutely. Absolutely.
You have to show up.
Absolutely. Okay, what's your like guilty pleasure right now? Is it a book? Is it
Oh,
a food that you're super into? What's your guilty
I mean,
pleasure?
chocolate was the first thing that came to mind. Like, I definitely like chocolate. Guilty pleasure, I've been painting, which I shouldn't feel guilty about, but I feel a little bit bad about the time that takes because I should be doing other things, but it's self-work.
I love that you're painting, Lindsey. That's amazing.
Yeah,
Yeah,
yeah, it's
I
good
love
for
that.
me,
Good for exactly.
helps
We
me connect to my breath.
Yeah, we all need more things in our life that help us connect to our breath, that's for sure. And okay, last question. If there are clients in Seattle listening, tell them what you would say to them. What's the feel that they get during a session? You've given us so much gold already, but here's your moment to like share what is the experience at your practice like for someone that's having a struggle with fertility, pelvic floor, endo, pudendal neuralgia, etc.
I think that what they will know is that they will feel heard, and hopefully they're going to feel good when they leave.
Yeah.
That should be the idea. And if they don't, we're going to figure out how to make that happen because it's a feel good situation. We all know that. That's what should happen during acupuncture is relaxation, hopefully connection to their body that they haven't felt before. inspiration, whatever, all the things. We want all the things to be happening in the treatment room, but walk out the door feeling good, relaxed, and happy.
I think if you're in Seattle, you definitely want Lindsey in your corner. She's a
That's
powerhouse and
right.
she's got the perseverance. She wants to make those good feels happen. So
Yep,
she
good
wants it for
feels.
you if you want it for you. Where can they find you?
Well, they can find me at Glow Natural Health and
Mhm.
also Seattle Fertility Acupuncture. We're on Instagram, we're on Facebook. Don't judge. It's work in progress.
Isn't it
But
always?
yeah, exactly,
Yeah.
exactly.
For sure. Well, Lindsey, this has been such a true pleasure to reconnect with you since the practical, to spend a
Great.
moment honoring the time that you spent learning about pelvic health and pelvic care, and also really getting your perspective and being able to share that out in the open with the world, with the acupuncture community. And I think conversations like these are the ones that are transforming acupuncture and bringing us to the forefront of people's minds.
I agree. And thank you so much for the work that you do and for putting this on and putting together all of your materials and all of your classes. Really, really valuable and doing really good work in our community. I appreciate it.
Aw, thank you so much.